Hello everyone, I'm Dr. Magesh Tunakar. So I welcome you all back to this new session. It's just a continuation of our diabetes mellitus that's been going on for now last 2-3 videos. So we have talked about what are the causes and risk factors for diabetes, and how do you diagnose, and what are the symptoms, and we have slightly touched on the management of diabetes mellitus. So this is just a continuation of our previous topics. So please make sure you watch this video without skipping it, and if you like this channel or if you like this video, please go ahead and hit the subscription button down below. Do you like it or leave a comment. Alright, so let's get in there, my friends. How do you manage diabetes mellitus? Managing diabetes mellitus is very easy and it is very tedious as well. There is an easy way of managing diabetes mellitus. The person who comes into a medical office and he gets his blood sugar checked, it's like 128, or is a young person like with improper or inappropriate lifestyle. So I do not want to just give him medications right away, because I would ask that person, okay, what kind of person are you? Like, are you really are you a determined person? Or if I can put you on a lifestyle modification, will you be able to follow it and achieve what you want to do? I want you to come back to me after 3 months and let's check your blood test and see how your blood glucose is doing with this lifestyle modification alone. If that person says, doc, my lifestyle is very tough, I cannot just move out of my table at my work, 9 to 5 I sit in my chair at my desk, I don't go anywhere, I just don't walk around, I don't take the elevator, I only take the elevator, I don't take the stairs, things like that. I eat a lot of fast food items, like I eat McD or KFC and whatever, pizza, many things, right? For maybe another person who is very cautious, who is very determined person, who is willing to put his effort into it, like he wants to go for jogging or go walking like 20 to 25 minutes a day in order to achieve that 150 minutes a week. If he is willing to go on a proper diet control, obviously I will not put that person on medications for at least 3 months. I will just assess how he is doing. So when he comes back to me for next visit, when I check his blood sugar, if it is less than 126, it's okay, it's well and good. Okay man, you are following my opinions, my advices, okay, you continue with that, that's it. But if a person says, doc, please you put me on medications, okay, cool, I can start you on medications. But when it comes to medications, what medications to be started, that's the most important thing. See, in olden days and current style of practice is there is some difference, like every doctor practices. Metformin is the first best initial drug for diabetes, metformin. Okay, there are so many drugs available in the market for diabetes. When it comes to diabetes type 1, you don't need to give tablets, because the reason for why people have diabetes type 1, because their pancreas lost its function. The pancreas is not secreting insulin anymore. In that case, you have to give insulin. You don't give tablets, because the purpose of giving tablets is to knock the pancreas to secrete insulin out of the pancreas, and there are many other functions for these tablets. So when the pancreas has lost its function in type 1 diabetes, there is no point in giving tablets to knock the pancreas to secrete the insulin, because the pancreas is completely burnt out, right, in type 1. So in this case, you give insulin from the outside, and there are many categories in this insulin. There is a rapid acting insulin, there is short acting insulin, there is an intermediate acting insulin, and there is long acting insulin. So your doctor knows what kind of insulin is okay for you, when he has to put, and how many units has to be put, all these things. So please make sure you follow your diabetologist or your physician to get your adequate sugar control. And many people they commit these mistakes when it comes to insulin administration. When they put insulin, when I ask my patients, they say like, okay, do you take insulin? Yes, I do take insulin, doctor. Okay, how do you take insulin? Yes, I put it here, doctor. I put it here, I put it here. I mean, there is a proper method for insulin administration. It has to be injected maybe in your tummy, or thighs, buttocks, or upper arms. The needle shouldn't be more than 4 millimeter in length. Okay, because this insulin should be delivered in the subcutaneous area, not intramuscular. So the needle should be 4 millimeter in length. So when you prick yourself, make sure you inject it and wait 10 seconds and take the insulin out. Okay, you mean injection out, because if you just prick it and take the insulin right away, injection right away, you may not have administered insulin properly. Okay, so the upper arm, abdomen, upper thighs, buttocks are the proper areas for insulin administration by injection. Okay, this is for type 1 diabetes. When it comes to type 2 diabetes, there are several medications, there are several categories. Okay, it starts from enzyme inhibitors to biguanides, metformin, sulfonylureas, DPP-4 inhibitors. You might have heard of these fancy drugs, sitagliptin, linagliptin, vildagliptin, lanagliptin, okay, all these drugs, right? And linaglutide, dulaglutide, all these medications, and canagliflozin, empagliflozin. These medications have got their own different mechanism of actions. But the best first drug to be taken, unless it is contraindicated, is metformin. Metformin can be taken, and some people have a B12 deficiency when they take this metformin in the long run. So make sure your metformin is okay for you, just so that you check with your diabetologist. Okay, when to take one medicine, when to take 2 drugs, when to take 3 drugs, and when do you have to go for insulin in type 2 diabetes? Because in type 1 diabetes, the only answer is insulin. But in type 2 diabetes, there is a different style of managing type 2 diabetes. I can start off with tablets. From 1 tablet I can build up to 2 tablets or 3 tablets, and at one point in time, okay man, this guy's blood sugar is not getting controlled with 3 different medications, I really have to put him on insulin. Or in some cases, you will right away have to jump and start insulin right at the moment, first time. Even before starting medications, there are several occasions for that. Okay, so when it comes to these medicines, oral medications, metformin is the first best drug to be given, or I will assess your blood glucose levels, fasting blood glucose levels after 2 weeks after I start your medications. If your blood sugar is under control, okay. If you are doing okay with one just medication, it is okay, that's it. In addition to these medications, I would always advise you to follow lifestyle modification, that's it. And if your blood sugar is not getting control with one medication, obviously I will have to put you on 2 different medications, and still not control, I will have to go on 3 different medications, because we have several categories, right? Like one from here, one from here, one from here. So I will get 3 medications on you. Even with these 3 medications, your blood sugar is not getting control. Obviously there is no other choice. I have to put you on insulin, buddy. You listen to it carefully. Medications work 50% and your lifestyle management works 50%. You cannot just take medications and the other hand you eat chicken, you eat sweets and all that, and you can't expect the medications to do magic. You should also do your part. You should also contribute 50%, and the medications do 50%, and you expect the result 100%. Okay, I hope you understand. So we'll meet you in our next video with more information on diabetes series. Until then, it's bye bye, Dr. Mahesh signing out.